flow through the heart. The heart has 4 chambers, 2 upper chambers, the right and left atria, and 2 lower, larger chambers, the right and left ventricles. When both atria contract, both ventricles are relaxing. And when both atria relax, both ventricles are contracting.
So you do have 4 chambers, the top 2 atrium and the bottom 2 ventricles, but they beat simultaneously. So when the atriums contract, both of them contract. It's like a 2-sided pump. So both of them contract and then the ventricles contract. So you think atrium, ventricles, atrium, ventricles.
You know what?
And at the same time as those atriums contract and blood's flowing down ventricles, they're relaxing and these are contracting. So it's just bump, 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 bump. Jason.
I know why they say that, you know how the heart shape is like that, you know. You can see it now.
Yeah, kind of.
I don't see it. Like, I see pictures of a heart. I don't know what a heart is.
Bam.
When the chambers of the heart relax, they fill with blood. Valves between the atria and ventricles, and the ventricles and vessels, close tightly to prevent backflow of blood. When the ventricles of the heart contract, blood is forced out of the heart into vessels. The heart is a 2-sided pump, right and left sides, that is continually receiving blood and pumping blood out. The right side of the heart receives deoxygenated blood from all parts of the body through the superior and inferior vena cava. The heart receives the blood into the right atrium. When the atria contract, the blood is forced through the tricuspid valve into the right ventricle. When the right ventricle contracts, the blood is pushed up into the right and left pulmonary arteries through the pulmonary valve to the lungs for oxygenation. Following oxygenation in the lungs, the blood returns to the left side of the heart through the right and left pulmonary veins into the left atrium. When the left atrium contracts, the blood is forced through the mitral or bicuspid valve into the left ventricle. From the left ventricle, it goes through the aortic valve into the aorta and goes to all parts of the body. Remember the heart's set of 4s, 4 chambers, right and left atria, right and left ventricles. 4 valves, tricuspid, mitral, pulmonary, and aortic. 4 major vessels, vena cava, aorta, pulmonary arteries, pulmonary veins.
You'll notice throughout any of the A&P how things are pronounced. Vena cava, vena cava. Depends on really where you're from, whether you're from the south, the north.
Vena cava.
Yeah, and so I say vena cava, and you'll hear a lot of it pronounced that way. And then you'll even hear like duodenum and duodenum, same thing. So just be aware, you know, that they are pronounced differently. And it's kind of interesting depending on what professor you'll have in your A&P how things are pronounced, especially if they're Middle Eastern. Okay, let's see. Blood flow again, don't stress, don't worry, we'll learn it. We do want to look at this though. So,
Are we labeling on this?
yes, there's lots of labeling, tons of labeling. So blood flow, we know the heart pumps blood out to the body and to the lungs as well. But this big aorta, we have some branches off of it. So these are going to supply the head and the top trunks, so the kind of the neck, head area, as well as some arms. Back behind here that you can't see, there are branches off of this aorta that feed the heart itself. So they come back, and there's 2 main ones that are gonna, we have your right coronary artery feeding this side, and it wraps around to the back. So if you take this heart and flip it this way, here's the right coming back. And a sinus is just an area that's kind of enlarged and has like a pool of blood. So again, it'll branch off and feed this side. Left coronary artery goes all the way down, feeds all of this, wraps around, comes back down here and feeds all of that as well. Red means blood's going to the tissue. Blue is blood's coming back. So we're coming back. back and going back to the heart to be oxygenated again.
But in real life, it's like a deep red and a bright red.
Right.
Okay.
Not blue. It's different shades of red. When you get older, there are things that happen with the heart, because people can have heart attacks in really small vessels and not ever notice any issues. You know, may have a little chest pain and then go about their day and be fine. But you will make new vessels. You can make new vessels. Especially an older heart will have a lot of new vessels made. Okay, we're gonna, again, we'll learn all of this. So which great vessel supplies blood to the right atrium? This is gonna be the largest vein that you have. The biggest and largest vein. Yes, A. We'll learn it all. Let's go ahead and look at cardiac conduction. So the heart has what we call a internal pacemaker. So the heart is self-stimulating. So it can beat itself. It paces itself. We don't really even need the brain to do it. It's got its internal pacemakers. So your SA node, AV node, bundle of His, Purkinje fibers, or bundle branches, then Purkinje fibers come out. Again, we will learn all of this. Your SA node is your primary pacemaker. Do you have any clue? Can you hypothesize what that rate would be paced at?
70 to 100.
60.
Pretty darn close. 60 to 100 is your SA node. So what is your normal heart rate normally? 60 to 100. So this one is the one that controls that. Say that your heart rate is around 40 to 50. Exactly. So this one failed, and if it fails, well then this guy will pick up. And then we get into 20s down here. So if all else fails, we will still beat. That doesn't mean that you're going to be very viable at 20.
You just be really tired.
So if you're at 20, does that mean you're just going to be like laying in a bed, not doing
What
anything?
about
Not
like
doing
a 6
anything.
or a 7?
You're dead.
You're done.
What about like an 80?
That's good. That's perfect. 60 to 100. Huh?
60 to 100 is good.
Yeah.
What about like a 90?
You're good.
Oh, you can't be too fast?
Yeah, you can be too
Go up,
fast.
you can, but 60
Yeah.
to 100 is good.
If you're exercising, you're going to be 160s, 170s, 180s if you're exercising.
Is that, that's what that is when I grab the bar, I'm on the bike,
Yeah.
and it's like 172
That's your heart.
over.
Yes.
Oh.
That's your heart rate.
Is that bad?
No.
And am I supposed to keep that at like a certain, at
Yes.
the same number? Oh.
Yeah. You want it above like 120 for at least 20, 30 minutes to get cardiac exercise, to get cardio, to actually
So I don't
burn
have to keep it,
calories.
like at 172, but like
But you
over
need,
120 at least.
yeah,
That's really high, 170, isn't it?
but it's,
I was
that's
really,
normal.
really, really fast.
But that's normal for you. If you're exercising and you're really going at it, that's fine. But 200s is not fine.
And I've never
220,
When I
220.
had my extra pathway, it would get inspiration. Like, what, I know,
No, I've never
I kinda had to get told what it was, but, like, on the picture, like, what kind of, like, made it that way? You know what I'm talking about? Like, I had an extra pathway that made my heart rate go over that. Is there, like, anywhere on the picture that, like,
You probably had,
I mean, I had WPW, which is one purpose in white.
you can have extra openings in the side, the chambers here. You can have one between here. You can have one between here. And those will cause irregular heart rates. So it's not actually the conduction, it's the pump itself. So because of that, you're not able to pump blood out like you should be. So the heart has to beat faster to pump what little bit it is getting out. Okay, so let's look at the conduction pathway through the heart and see what's going on with that.
When are we going to do the walkway through the heart thing?
That'll be next week. Because tomorrow we have pink out day, so we won't get to then.
Will it be Monday of next week? What are we
Yeah,
doing?
it will be Monday.
What are we doing for pickup?
got to get them done.
She wears. I'm really scared.
The checkoffs, we're going to, well,
Cardiac muscle is unique in that it does not depend on stimulation by extrinsic nerves to contract. Instead, it contains pacemaker cells that allow it to contract spontaneously, an ability called automaticity. The electrical impulses generated by the heart follow a very specific route through the myocardium. Normal cardiac impulses arise in the sinoatrial, or SA, node, which is located in the wall of the right atrium just below the opening of the superior vena cava. From there, an interatrial bundle of conducting fibers rapidly conducts the impulses to the left atrium, and both atria begin to contract. The impulse travels along 3 internodal bundles to the atrioventricular, or AV node. There, it slows considerably to allow the atria time to contract completely and the ventricles to fill with blood. After passing through the AV node, the impulse picks up speed. It then travels down the bundle of His, also called the atrioventricular, or AV bundle. The AV bundle soon branches into right and left bundle branches. Purkinje fibers conduct the impulses throughout the muscle of both ventricles, causing them to contract almost simultaneously.
don't you just like saying that? Purkinje fibers?
For kids.
Purkinje. Just sounds cool.
Sounds like Mortal Kombat character.
Okay, so this conduction and the actual beating of the heart gives us a reading on an EKG strip, and that's what this looks like. So this is what you would see on an EKG strip, electrocardiogram. So EKG strip is actually detecting the electrical impulse through that heart. What is kind of crazy is that this can be happening. We can have the electricity coming from one, going down through those different nodes, and you can see this on an EKG strip, and that heart cannot be beating. So that's why, as nurses, when we're doing courses on like ACLS or something, and we're reading strips, just because we're looking at the monitor, we still have to look at the patient and know what we're assessing with that patient. Just because we don't pay always attention to numbers. So then this strip may say the heart is beating, but when I go and take a pulse and I feel nothing, then that means that heart's not beating. I don't automatically go off of what that strip says. But we do want to know what this strip means. So, number one, a P wave, that's the very first hump that you see. That is just the atrium contracting. So the impulse telling the atrium to contract. Then we'll come down and you'll have, there is a wave that's hidden in this big QRS complex, and that's the actual atrium relaxing. That gives an impulse or a little bump in the strip as well, but you can't see it because it's hidden by this big, huge QRS. So what do you think this is representing contracting?
The beat.
Yeah, the big ventricles. They're huge. They take a lot of power. So atrium, then you have a big ventricle contraction, and then after that you'll have a little relaxation of the ventricles popping
And then
open.
another big one.
Then you would have another P, which would be atrium. Then you'd have another ventricle. Then you'd have a T wave, which is the ventricles relaxing.
And that's called a
This is your normal sinus rhythm. This is what a normal sinus rhythm would look like. If you have any issues, we look at this strip to see if this patient's having any dysrhythmias, if they're having even a heart attack. If this is really high, the T wave, then that means that heart's not able to relax completely. Sometimes you can drop P waves where you don't even see a P wave on this. That all tells us something about that heart. So when they do an EKG, this is what they're looking at, is the electrical impulse of the heart. Cardiac cycle is just that, just like breathing is inhale and exhale, that's one respiratory cycle. Cardiac cycle is the beating and relaxing of the heart. So contraction, contraction, relaxation. So systole, again, we're look mainly at our ventricles because those are the big ones, particularly the left one. Which one do you think's bigger, left or right?
Right.
Bigger? Be the left coming.
Left. Why is the left bigger?
Because oxygen did to push it out farther.
It has to do with the push. Think about what it's pushing against. Right is pushing into lungs. Does have some pressure. This is pushing out to everything, the whole body. So that's a lot of pressure to push against. So the left ventricle is actually larger. So that's what we're looking at, is that left ventricle when we're measuring blood pressures. So systole would be contraction, diastole would be relaxation. Let's open, blood close, ventricles, superiors. Okay. This is just looking at our electrical impulse and the contraction of the heart, what's going on with that each time. I think I've got a good little video for it. And again, we will learn all the valves and things when we walk through, so don't stress about that just yet.